time as well as for giving consent to share your knowledge to our students and the faculty members. On the occasion of National Pharmacy Week, I feel that students will be motivated and will also acquire knowledge about the field of pharmacy. Unfortunately, we are not able to welcome you physically. However, we welcome you at Adamas University by virtual mode, if possible, in a near future. We are ready to welcome you at our university by physical mode. Actually, in the Department of Pharmaceutical Technology, there is a M.Pharm, B.Pharm, D.Pharm programs are running. So this is the platform for you, sir. Thank you so much. Over to Anna Shabari. Thank you.
Thank you very much, sir. So I would like to call our distinguished speaker, Dr. H. Rubesh Kumar, to start his speech. So we are actually looking forward to this technical session. Thanks for being with us, sir.
Thank you, madam, and thank you to all the faculty members and all the students of Adams University. So I'm very much delighted to have a small talk with you and share my views. I'm not going to say something about anything research oriented. I'm not going to speak with you. So as a general, as a topic oriented, I want to narrate some topics on what is medicine and what is the rational use of medicines. Okay, so especially after the pandemic corona, now it is becoming epidemic. Hope so it is going to reduce. So the role of healthcare profession was very huge. There were huge loss, and there were so much sacrifice given to just save the world or save the society. Okay, so I thought I would keep a talk on what is a medicine, all these things. Okay, so thank you, sir, once again for inviting and giving a brief introduction to me. So I'll just share my screen and I'll start my speech. Okay? Good afternoon to one and all. Yeah. Madam, my screen is visible right now.
Yes, sir, absolutely.
Today, my topic is role of pharmacist in rational use of medicine. Okay, so this is a current topic, very hot topic, and it is also an older topic. Why I say it is a very older topic? Okay, as we know, this rational use of medicine, it is not a new one. Okay, it is a concept was evolving throughout the world 300 BC. Okay, so before going into the topic and what is rational use, what is irrational use, we can understand something. Okay, so because we are saying about medicine, so we have to understand about first thing is prescription. Okay, what do you mean by prescription? Who prescribes? Okay, so obviously prescription is done by in India, it is done by doctors. Okay, a person with the MBBS qualification. But we have to know when was the first prescription of the world was documented. The first world prescription were enhanced on a clay tablet in Mesopotamia around 2100 BC. So this was the first prescription which was happened. Okay. Next one, which is the oldest medicinal system in the world. So India. Okay, India has a oldest medicinal system in the world. That is nothing but Ayurvedic. Okay, holistic medicine. We say it. Okay. Next one, we come to our part. Right. What is a
Sir, may I just interrupt a little bit?
Yeah, yes.
Sorry to interrupt you. Actually, your screen is not visible to us. At first, it was visible. Now it's looking blank.
Now it is clear, madam.
No, it's not visible. It's,
Is it visible? No.
No. You can just stop sharing and again you can share the screen so that it can solve the problem maybe.
Yes.
Yeah, it's visible now, sir.
Is it visible, madam?
Now it's visible, but
Yeah.
after resuming the slideshow, I don't actually. We have to see.
Yeah, one. I'll just move the next slide. So this is
Yeah.
this is but nothing but the prescription. First documented prescription, as I told you, it is from Tonia from 2100. Okay, madam, is it visible? The next screen.
No, ma'am, sir, the next slide is not visible. The title slide is only we can see.
So now it is visible, madam.
Yeah, yes.
So better I'll go through like this way only. See, then we come to the drugstore. So drugstore was first established in the 18th AD, that is in Baghdad. Okay. So there are some illustration about how the pharmacy will be looking. So there are some illustration from the 14th century onwards. The oldest medical shop, right, or a drugstore in America was set up in the year 17th century. Okay. So these are some brief introduction. But this is clear. This slide is clear, no?
Yes, sir. Absolutely clear.
Yeah. Okay. So now we'll understand what is the rational use of medicine. Okay. What is the rational use of medicine? The rational use of medicine requires that patient receives medicine appropriate to their clinical need. Okay. So a patient has to get the medicine as per his clinical need in the right dose that meets his own individual requirement for an adequate period of time and at a low cost to them or their community. So this is, we call it as a rational medicine. Okay. So when we say what is rational medicine, there are different parameters that has to be understood. Okay. So different parameters like right information to the patient, right dosage form, right route of administration, right indication, right dosage form, right duration of treatment, right frequency of administrations, and a right follow-up. So this is, for talking, this is clear, right? This is rational use of medicine, and whatever the prescription is done, whatever the medicine is supplied to the patient is consuming. But as a reality, it is not true. So instead of rational use, the global context becomes irrational use of medicine. So that's what the WHO also saying. There is a lot of irrational medicinal uses are happening. We'll understand from one by one. So what is that? Why? What is the cause, and how we can overcome? Okay. So as a global context of this irrational medicinal use, the challenges of irrational medicinal uses in global, it's common to all the countries. So as per WHO, it is estimated that more than 50% of all medicines are prescribed, dispensed, or sold inappropriate, and that 50% of all patients fail to take their medicine correctly. Okay, normally, childhood, when our father or mother or brothers or sisters, anyone is going to give medicines, we have like we take a poison. Okay, so what we'll do, we'll just swallow the tablet. After swallowing, like camel, we'll spit it out immediately. Okay, this is what happening, right? So what is this happening? Okay, both the healthcare provider and the patient contribute to the irrational medicinal use. So what is the problem? Okay, the provided by the prescriber. What is the problem with the prescriber? There is too many prescription, or too few or inappropriate medicines, or many prescription. The appropriate medicine is wrong dose, formulation, or duration. So this is a problem with the prescriber. So as you know, all countries have their own regulatories, their own medical council, different prescriptions or a different pattern is followed for prescribing for a patient. I came across, WHO has reported one country, okay, named Zimbabwe. In Zimbabwe, the prescription, how it is done, the prescription is given for each and every symptoms said to a doctor on a particular visit. Okay, so normally, obviously, any patient go to a doctor, we think, we'll ultimately say everything so that the doctor will give the prescription. So ultimately, we'll have the cure. So in Zimbabwe is so that if at all you go to a doctor, for every symptoms you say to the doctor has to prescribe a drug. Okay, normally you go with a cold, okay, simultaneously you have a headache, fever you will be having, running nose you will be having, and allergy symptoms you will be having, tasteless will be having. For every symptoms you say it out, the doctor has to prescribe. So how much medicines they're going to take? That's the problem with the prescription provider. Additionally, the patient contribution to irrational medicinal use through self-medication. The next one, pills sharing or not completing a treatment regimen as prescribed. This is a problem, right? As a patient, they are not following up with the prescription or a dosage regimen. Normally, we know, right? Any antibiotic, it is given as Bisin for 3 days. That is 6 tablets. We have to take it for continuously 3 days. There will be some supplementary drugs will be given to subsidize the other unwanted pharmacological action. So patient will not take the antibiotic, but they will take the vitamin tablet because these are very sweet in nature. So they'll be taking it. Okay. So this is additional information. Okay. So what happened whenever there is a exhaust or irrational use of drug is happening? As we all know, medicines are essentially a foreign substance to a human body, and if not used with the utmost care, they can harm our normal physiological system. Hence, the medicine has to be a good quality, safety, and efficacy. And besides, this should be a rational, used as a rational. So what happens if this is not followed? If medicine is not good, right? So what will happen? So it becomes unsafe treatment, prolongness of the illness, distress and harm to the patient, increase in the cost of treatment, increase in the morbidity and mortality, adverse drug reaction, blood-borne diseases like HIV, okay, and loss of patient confidence in health system. Okay, now during the pandemic we saw, right? So initially 2020 it started. Okay, there were so many medicines prescribed normally, right? We will not understand from India, we'll understand from foreign countries. Everything is from foreign countries. So whatever the medicine pronounced by the foreign countries, it's not that much safe, or it is not the first line drug. Okay, finally in India, no, right? There are 2 different companies they produced, and now it is safe, right? So the quality and safety of the medicine should be it should be a quality, it should be safety, and it should be efficacy. So by this one, we can just eradicate the irrational drug use, right? So next one, what are the irrational causes of irrational use of drug? Okay, what are the causes? So we'll see one by one. First one is polypharmacy. Okay, this is a major thing, right? Polypharmacy describes the use of multi-drug by a single patient to treat one or more conditions. It is most common among the elder people, age 65 and above. It is estimated to cause over 100,000 deaths per year. So obviously, okay. So the polypharmacy is a major problem. So where we take multiple drugs for a common element, right? So it is like normally, in TV you might have seen this ad, right? What is that ad? So a drug a single drug is given to all conditions, right? And it has been prescribed to generation also. Okay, this is about the polypharmacy. Okay, next one, inappropriate use of antibodies and anti-microbial agent. Okay, this is a major problem nowadays. The global is facing. Okay, so what is this one? So this is overuse and misuse of antibody and antimicrobial agent contributes to your antibody and antimicrobial resistance. Okay, so say for example malaria. Okay, malaria. So for malaria, first line drug we call it as chloroquines. All the quinine molecules we use it out, chloroquines. So it is having among 92 countries, 81 countries are having the complete resistance to chloroquine. That's why nowadays any malarial drug it is not cured by the frontline drugs. So still we have to go for the superior drugs. So next one is tuberculosis. Again, the frontline drugs are completely resistant. It is around 0 to 17%. Next one is HIV and AIDS, 0 to 25%. So all the frontline antiretroviral drugs, okay, all these things are having the resistant. Even you give the frontline drugs, already the frontline drugs is overtaken by the population, so it is having the resistance. So gonorrhea is a sexually transmitted diseases. So nearly around 5 to 95%, all the people who are resistant to this penicillin, okay, gonorrhea, this microorganism is completely resistant to this penicillin. So next one is pneumonia, that is bacterial laryngitis. This is also resistant to penicillin, nearly around 0 to 70%. Next one is diarrhea. So again, ampicillin and cotrimoxazole resistant is there, and hospital infections. Okay, so this is a common thing whenever you go as an inpatient, or sometimes nowadays if you go as an outpatient also, you get infections. We call it as hospital infections. So for this hospital infections, normally we take penicillin or cephalosporins. Nowadays, this penicillin or cephalosporins are not, as per treatment, it is not going to have much effect on this infections. So we have to go for the superior drugs. So this is a common problem with the overtaking of this antibiotic. So as per the WHO, what they are saying, in India, especially with the pregnant woman, they are having some urinary tract infection. Common frontline drugs cannot be treated because this cotrimoxazole 40 to 65% are having a resistant. Same like that way, amoxicillin, ciprofloxacin, and cephalaxin. All these things are frontline drugs. Okay, normally you go to a drug, you say I'm having a urinary tract infection. Okay, they will prescribe these drugs only: cotrimoxazole or ampicillin or ciprofloxacin or cephalaxin. All these things. If you see, it is almost having 50% of drug resistant. So if you go to a doctor, if he's prescribing this one, within, I told you, 3 days of treatment, the infection is not cured. What normally people will say that particular physician is not a good person, is not having a diagnostic sense. So we'll go to the another doctor. So while going to the another doctor, we'll not say we went to this particular doctor. Okay, so another doctor also simply is going to prescribe the same thing. So by that way, what is happening? The resistance towards the particular microorganism are increasing. Same like that way, antibiotics. Okay, so antibiotics used in India is like half patient in India and 1/4 or less patient in South Africa to get antibiotics. Okay, much inappropriate use of antibiotics are seen in India. Okay, next one is motivation and the consumers. Okay, so patient demands look for quick cure. That is also one problem with getting the resistant towards or irrational use of the medicine. Lack of CME, that is continual medical education. Okay, so there is no patient sheet to say what is the drug, why you are prescribed with the drug, and why you are taking this drug. Okay, there is a lack. There is a gap. There is a bridge, or there is a big, huge gap is there. Okay, even the patients are not reluctant to stand and listen what a pharmacist or what a nursing staff or what a doctor is going to say for things. Okay, unwillingness to attend for a fear of loss of customs, or uncontrollable pharmaceutical promotions and involved in financial gain. This is a major thing. Okay, just if you take it out, any kind of ad in the TV. Okay, so even though there are some advertisements are prohibited, okay, when it comes to Drugs and Cosmetic Act, there are things are there where the cosmetics as well as drugs advertisements are prohibited. Even though you get so many advertisements. The best example I can give. Yeah, I can give it on Vicks. Okay, Vicks Action 500. Okay, so that is that, and Anacin, Metacin. Previously, we used to have aspirin ad also. Nowadays, it has been banned because of these advertisement. People tend to take the medicines, okay, without knowledge, and they become irrational users. Okay, next one is overuse of drug or misuse or underuse or abuse. So these are the major concept of irrational uses. Okay, so as per the US FDA or US, they are saying since 2004, 94% of the persons are either misusing or abusing the drug in a different. The Food and Administration, FDA, explains that the difference between abuse and misuse has to do with the individual intention or motivation. So it is not concerned with either a pharmacist, either a medical staff, either a nursing staff. It is the intention of a particular individual or a motivation given by the society or friends or the circular or environment where he presents. The abuse or misuse of drugs are more. Okay, so what is the difference between abuse and a misuse? What is abuse? That means without a prescription, a medicine is taken. That we call it as abuse. And what is misuse? Misuse is nothing but not strictly following the prescribed medicine or instruction given to your prescriber. Okay, so next one. Failure to prescribe in accordance with the clinical guidelines. So as I told you, so Zimbabwe, okay, particular country where for every symptoms, it is must and should the doctor has to prescribe a medicine. Okay, so they will not go according to the clinical guidelines. What is clinical guidelines? Clinical guidelines is nothing but there are some stepwise process which is given so that the patient or the doctor or the nursing staff or the pharmacist has to follow certain guidelines for dispensing or for prescribing or to administer the drug on a particular thing. Okay, so what is the guidelines? So general guidelines, it says about before prescribing, you have to say it as pre-prescribing, okay, pre-stage of prescribing. So you have to understand about the patient, pre-history, and you have to discuss with the patient and check what is his condition. Next one is you come for the prescription. After prescription, you have to understand whether the right patient, right medicine, right dosage, or right route of administration, and right duration, right labeling, right storage condition is given. Okay, then how the patient is administered. Okay, whether it is going to a right patient, right medicine is given, right dose is given, right route of administration is given, or right frequency the patient receives the medicine. Okay, so if you go for a technical aspects, so like all common diseases, okay, so like hypertension or a diabetes or a cardiovascular disease like any cardiac disturbance. So there is a protocol is followed where you will get the complete idea of the patient. Then you analyze with the data which you are storing. Then the drug has to be prescribed. Okay, there should be a correlation in between the past clinical guidelines and the present clinical guidelines. Okay, so this is also a major problem: failure to prescribe in accordance with the clinical guidelines. Next one. This is the most common thing, okay, self-medication, right? So as per the Indian Journal of Dermatology, they are saying nearly 75% of the drug which is taken as self-medicine, okay? So either it is a reference from senior friends, family members, or it is from textbook or reference book or self decision taken by the patient, or it's from the drug advertisement, internet or media. So most of the self-medication are belonging to this category only, near to around 75%. Okay, as a pharmacist, it is only 10% over-the-counter drug in drugstores, and drug left over or prescription issue to others. This is like 3 to 4% where we are using it. Okay, so normally if you have an illness, parents or elder persons, they used to give the medicines which is left over, but they will not have a knowledge about what for the medicine and why it is given for you. Every medicine has its own individuality to a particular person. So if you just take it out, most self-medicated, that means self-medication taken in the global. So it's with South America. So it is around 15% of the population, they go for the self-medication. Okay, this is a major problem which is related to the self-medication. This is also important things with the irrational drug use. Okay, so when you come to the different class of drug which has been used as a self-medicated aspect, so you can see the bigger chart. So like it is classified into rural and urban area. So where there are almost all the classes are taken as a self-medication. Okay, among the self-medicated things, if you just see it out in the pie chart, 50% of the drug are from NSAIDs. Okay, non-steroidal anti-inflammatory drugs. So normally, normally in the house, if you say headache, normally what is the tablet will be given? A paracetamol. Okay, so it started with 250, now it is 500. So nowadays we are getting for 650. and 1000 milligrams also. We don't know what is the why we are taking the paracetamol. Okay, if you have headache, take paracetamol. Okay, so paracetamol will not be coming under the category of non-steroidal anti-inflammatory. Okay, so other thing is that if you just consider, the paracetamol is the world deadliest drug, so that it gives a hepatic toxicity. Okay, so even though we see we take it at 650 milligram or 100,000 milligram, okay, we'll take it 3 times a day. So, but we don't know. Okay, it slowly creates a hepatic poisoning or hepatic effect. Okay, so this is about the consumption of drugs. Okay, throughout the world as a self-medication. Okay, normally 50%, more than 50% we take NSAIDs. Okay, so you know about the story of Nimesulide also. Okay, so what is the story of Nimesulide? In 1952, US banned Nimesulide. They threw the moiety, okay, of Nimesulide. They banned it completely in US. But still today in India, today also you go to a drug, okay, you will get the Nimesulide tablet. Okay, so the best brand I can say is NIMS. Okay, we say it as NIMS kid. We get for kids also, we get syrup. Okay, so what is the problem with this Nimesulide? Even though the American government thrown, Indian government or Indian strategy, still we are prescribing, it has been prescribed, it has been sold, it has been circulated inside India. Okay, there was a big debate, there was a case filed against the Nimesulide, but still we are using the Nimesulide. The only how the judgment went against the ban of Nimesulide is that completely they told Indian has resistant over Nimesulide. So the Nimesulide will not produce any toxicity in Indian population, that is Indian race of population. This was the judgment given, right? So this is the problem which is related to the self-medication. Okay, so next one is non-adherence of dosage regimen. Okay, so what is non-adherence? It's nothing but the patient is completely ignored of taking the medicines. It is not only related to the patient, it is related to so many factors. It is a factor related to the illness factor related to the medicinal factor, patient factor, then caregiver factor, and physician or service person. If you just say it out, illness factor, insight, okay, conjunctive impairment, positive and negative symptoms, okay, depression, and substance misuse. This is a factor which is related to the illness. Medical factor, effectiveness, side effect, dosage form, formulation, cost, financial cost of the patient, co-prescription drug and complexity of regimen, past medication experience. Okay, normally, right, everyone have had this side effects. Normally, if you take a paracetamol for headache, okay, ultimately you have a drowsy feeling. Okay, so that becomes a side effect. Okay, normally. So this is a medication factor. Next one is patient factor, the past history of adherence, attitude towards the medicine and illness. Okay, normally, as I told, no, in childhood, right, if a father or mother putting a tablet inside and you drink water, so it is a miracle thing. What magically what we'll do, we'll only consume the water inside. Miraculously, after 5 minutes, after dad or mom turns to the opposite side, you spit the tablet out. Okay, normally in childhood, everyone have did this one. Okay, so this is the patient compliance or patient factors. Next one is caregiver factor. Okay, so even the patient is ready to take the medicine for the right to prescribe the medicines. There are problems with the care giver. Okay, the person who's next to you, they will say, "Hurry, you don't take this yellow color tablet." When I was using a yellow color tablet, it created some problems, right? So there are some things are there. Okay, they will not understand it is a yellow color tablet or it is a white color tablet. Okay, only a doctor or a pharmacist or nursing staff knows what is a yellow color. There are 100 yellow color tablets. Okay, next one is physician service and factors. Okay, therapeutic alliance, okay, communication, ease of access, clinical attitude to the medicine, okay, then discharge plan and communication between the services. Okay, this is a problem. This discharge plan very recently, the past 2 years, the COVID discharge patients, there are so many factors are there while discharging or not discharging. Okay, for your kindness, there are patient has been admitted and all the all the person who don't want to discharge their parents or their relatives once they are admitted in the hospital. This is the survey. It created a social disturbances. Okay, this is something. So non-adherence to the dosage regimen. Next one, lack of information. Right? What is this lack of information? The patient is confused whether to go to hospital, what kind of hospital. There are so many advertisements are coming in the TV. Okay, recent past. What is the recent advertisement? If you say infertility centers. Okay, there are disciplinary hospitals are there. Okay, patient get confused. So then patient thinks either going to doctor or nurse, because nurse is giving the injection or medicine at the right time. So she will know whether he'll go for the nurse, or to avoid doctor and nurse, they will go for a pharmacist, or finally they will go for self-medication. So there are patients, okay, there are a few members are there, okay. So what they will do, if they have fever or thing, they will go and open a drug box which is kept in every house. They will open it without reading the medicine. They will take a drug. Okay, this is a drug effect. This is lack of information. The other thing is that faculty and inadequate training and education of medical graduate. This is also a major problem. Major problem in the society. Okay, there are so many things which are related that proper educational system or a proper education is not been done by the graduates. Next one is poor communication between the healthcare profession and the patient. So poor communication. So only patient thinks the doctor is ready to take all my wealth. Doctor thinks it is a chance to take all the wealth from the patient. Okay, this is what the poor communication between the healthcare profession, right? So how to achieve this rational selection of right medicine for the right patient based upon the clinical needs? Okay, so how we can do it all? So first one is relevancy to the disease. So relevancy to the disease in the sense, there are some diseases, we call it as prevalent diseases. What is prevalent diseases? So the diseases which are existing, okay, in a particular area or in a particular society or a particular community or in a particular country. So these we call it as a prevalent diseases. Okay, a patient comes to you, so they have to understand whether he is categorized under prevalent disease or non-prevalent diseases. Okay, what is prevalent disease in India? So there is a cardiac vascular disease, stroke, respiratory, tuberculosis, COPD, okay, diabetes, Alzheimer's disease, malaria, okay, and diarrheal diseases and meningitis and other tumors. So if you go to the global thing, it is much more similar to the Indian diseases only, but the cancer stands out. It is around 96% as global indication. Right. Next one is efficacy and safety. So this is the most foremost thing when we understand, when we are going to give a effective and safety drug, so the rational use of the medicines can be achieved. So based upon the objective results from pharmacological study includes phase 2 clinical trial and or additional phase 3 clinical studies has to be provided. Okay, so as per WHO, what they are saying, the clinical quality of a medicine, it's coming from effective and safety of the ingredient, galenical formula, and information on appropriate safe use of the drug. Okay, so all these aspects has to be pre-qualified before the medicine is marketed. Okay, so I hope everyone knows what is a clinical trial. Okay, so I'll just go through. So clinical trial, normally we have preclinical trial, clinical trial, and post-marketing or post-surveillance, we call it as. So in clinical trial, there is phase 1, phase 2, phase 3. So especially in phase 1, they will understand with very limited patient. Phase 2, it is for the safety and efficacy of the drug. Again, it is a little bit population of healthy patients will be used. And phase 3, there will be a large number of population will be used for understanding the safety and efficacy. So all these things will be carried out under a healthy adult only. Okay. Then after phase 3, it will go to the regulatory submission, and finally it will go to the marketing. And from marketing, it will start with the phase 4 clinical study that we call it as post-marketing approval surveillance study. So here what they will study about the side effects. Okay, so we say it about the effectiveness and the safetiness. Next one is quality. Okay, the quality of the product should be good as it affects the therapeutic effect of the drug. So what we have to do, there should be infrastructure for quality assurance, quality control, correctiveness and preventive action, validation, self-inspection, and regulatory aspects. So quality implementation, okay, and system implementation finally lead to a quality product. So this will make the rational use of drug. So next one, cost of the treatment regimen. Okay, so nowadays, okay, again, Corona, right? We don't know. Patients treated for free of cost also, the patient treated for crores together also. We don't know what is the treatment went through. Okay, so the cost of the treatment regimen, not just to the unit. So there is a complete protocol is there, how the total cost of the treatment are calculated. Okay, it is like a direct costing or indirect costing. There is a formula which is involved to price a particular drug or a treatment thing. Okay, so everyone knows what is the world costliest drug. Okay, it is around 16 to 18 crores for a single shot. Okay, it's a drug. Okay, everyone knows, right? So next one is appropriateness to the capability of medicinal profession at the different level of healthcare. So the level of expertise required to prescribe, administer, and monitor the safety and adverse effect of single drug or a group of drug in the therapeutic category must be considered. So it has to be clearly considered. So there should be appropriate persons to understand what is the level of medicines, or what is the level of the compatibility of medicines to the patient has to be understood. So same like that way, contribution should be given to the competent of local person in making the correct diagnosis. So it's not only from the central government or from the persons, from the regulatory authorities. It also to be included the local person who's making the correct diagnosis. They are also to be included. Okay. So if you just come drug monitoring in India, CDSCO New Delhi that takes the major part in drug monitoring in India. So apart from the marketing authorization holder and UPASA monitoring center, so all this come together to frame a national coordination center. So it is a Pharmacovigilance Program of India. It is a Indian Pharmacopoeia Commission, Ghaziabad. So they'll have a steering committee, working committee. Okay. So in the working committee, there'll be a single review, core review, and quality review panel. So they will monitor the ARD, okay, ADR, that is adverse drug reaction. So it will be obtained from the healthcare profession and the patient, and regional training centers are there. So this will be reported to the zones, different zones in India. There is North Zone Ghaziabad, South Zone Chennai, West Zone Mumbai, and the East Zone Kolkata. So these are the area. So where the complete monitoring of the adverse drug reaction taking place in India are monitored by CDSCO. So if you just go to the worldwide, so US FDA, they are also following a different similar kind of strategy like India. So they are having the US FDA. Okay, they will understand about how the drug is done. Okay, that means fourth clinical trials, that is fourth phase, that we call it as post-marketed surveillance. Okay, so this is about the thing. Next one is local health issue or local health problem. The influence of local prevalent diseases or condition on pharmacokinetic and dynamics parameters modify the therapeutic response has to be considered in making the selection. This is also four most important things. Okay, so example is malnutrition and liver diseases. Okay, so most in India, or we call it as a second nations, we call it as. Okay, malnutrition is a major factor. So this particular graph, this is called as the first disease or a first malnutrition atlas of India, we call it as. Okay, so here they say it about, so what is a malnutrition, what is the weight, overweight or underweight of the children, which is calculated in a different district level. So before giving a treatment, we have to understand about the local health problems or local health issues, then only we can just make the rational use of the medicine. Okay, next one is benefit and risk factor. So when several comparable diseases are available for the same therapeutic indication, it is necessary to select the one which are provided most favor. So first we have to properly examine diagnosis, then we have to give a treatment, after treatment also we have to follow up particular things. Next one is preferential factors for evaluating therapeutical equivalency, and when two or more drugs are therapeutically equivalent, preference should be given. Okay, so this is again, okay, so it will be given with the bioequivalence study, preferential factors, and proper medicines has to be given so that the rational use can be done. So periodic review of drug list yearly or whenever necessary to incorporate significant new therapeutic advance and selected drugs. Okay, so next one, finally, what is the WHO recommendation for promotion of rational use, rational medicinal use? So establishment of multidisciplinary national bodies to cooperate policy in medicinal use of clinical guidelines, development and use of national essential medicinal list, essential of drug and therapeutic committee in district and district hospitals, and inclusion of problem-based pharmacotherapy training in undergraduate levels. Supervising and auditing and feedback mechanism has to be established. Use of independent information on medicines, public education about the medicines, avoidance of preserve financial incentives. Okay, so for this is a major problem. Okay, so where WHO are releasing so many incentives to so many countries, so what they are doing, instead of properly using the incentives, they create their own diseases and they misuse these incentives. Okay, the best example I'll say, how many of you know there is no term called as flu, that what we call as plague? How many of you know there is a term which is not called which is not there in the medical society, plague? Okay, I don't know how many of you know it. Okay, actually it was a disease on a particular duration, plague, where the therapy or all the things were in demand throughout the world. Okay, so what happened, finally a Canadian doctor and a pharma company was booked for creating a new diseases out of which they started earning it. Okay, you can just surf the Google and you can find it out, what is that disease and who was the person. Okay, there's no time for discussing all this topic. Okay, so then use of appropriate and enforcement of regulatory affairs. Okay, so the treatment choice, it depends upon essential social work groups and workplace and information. Okay, proper knowledge, habit, social culture and factors. Okay, economical factors, authorization and supervision, relationship. Okay, so infrastructures, work and staffing, influence of drug industry and scientific information. Okay, so finally, okay, the role of pharmacist towards the contribution in promoting the rational use of drug. Okay, so the role of pharmacist are day by day it is continuously changing in modulating needs for the society. So the pharmacist is no longer a supplier of medicines, but a coordinator between a different members of healthcare team and the patient. Okay, so the pharmacists are called as custodian of a technical information on a medicinal product. Obviously, okay. Previously we are called as compounders. Okay, so now we are called as pharmacists, where we have the technical knowledge and we are the custodian or we are the patent holder of a knowledge about a particular medicine which no one knows, right? So next one, hence proper role and involvement of pharmacists in safe and rational use of medicines and overall healthcare becomes a crucial point. So a pharmacist has to involve in different aspects like member of drug and therapeutic committee, drug procurement, drug storage, dispensing, patient education and patient counseling, drug information services or drug information centers, and pharmaceutical care. So here pharmaceutical care is nothing but manufacturing. Okay, the various aspects related to the manufacturing. Okay, so this is what I'll conclude. Okay, a pharmacist, the doctor gives lives to a patient through medicine, but a pharmacist gives life to medicine through his knowledge and skill. Okay, so I thank all the opportunity which is given for me. Okay, thank to all the university officials and the School of Pharmaceutical Technology, dean and all the coordinators. right, for giving this opportunity. And proud to be a pharmacist, right? So pharmacist during this pandemic, healthcare profession, exclusively this pharmacist society helped a lot. Okay, so thank you.
Thank you so much, sir, for giving for such an informative session we have. So basically, all of the things we have studied, we got to know from our seniors, our faculty members. We have seen so many pharmacists are working there day and night, especially during this pandemic and throughout the year as well. So we have seen this, and it is actually evident from your is in this short duration from your presentation as well. So now I would like to request all the participants, if they have any question, any query, they can ask our distinguished speaker. You can write your questions here in the chat box, or you can also unmute yourself and you can ask the question. So I would like to open the house for the question and answer.
Yeah, definitely.
Yeah. So I can expect some of the questions from our students. So students, you can ask the question directly, or you can type your question in the chat box. I guess they have understood the things.
Yeah.
Actually, the presentation was pretty much clear, and it was very lucid. Actually, everyone will be able to understand it. I personally, I felt so. It is very informative. It is very easy to understand. So I guess that's why the students, it was very clear to them.
Thank you. Thank you so much.
Yeah, exactly. It is our honor, it's our privilege to welcome you and to have you as a speaker.
Yeah, thank you, ma'am. So I thought I will be suited to the particular theme which is given by your.
Yeah, exactly, sir. Actually, it was very much appropriate.
Yeah.
So the roles and responsibilities, their duties, their hard work, everything was very much evident. So you have started from the history of the pharmacy itself, the profession, as an education, then from the roles and responsibilities, this relief of the layman, how to make them understand, how to counsel them, and now in which shape the pharmacy profession has become. So everything you have explained it so well. So it was very informative.
Thank you, ma'am. So once again, thank you to all the management who given me the opportunity. And so, my dear proud pharmacist, okay, all the best. So
yeah, we all are very much proud.
Yeah. And somewhere in the world, right, we'll meet. And the pharmacy society is very small.
Very small, actually.
Very small, and we can meet, right? Thank you.
Okay, so on behalf of the Department of Pharmaceutical Technology, School of Medical Sciences, I would like to present the certificate to you to be with us as a token of gratitude. So let me just share the slide. Let me just share the screen of mine, and then I can present the certificate to you. So is it visible?
Yes.
Okay. So this is from all of you, all of us from the department. So it is our token of gratitude. So it is a present from all of us.
Thank you. Thank you so much.
Thank you, sir. Thank you. Okay, so this is all for our technical session. Now we are going to move forward to our our next event, that is the so just a minute, I have to stop my sharing. Yes, and so this is all for our technical session. Now we are moving forward to the competition we have actually mentioned in our registration form and in the flyer as well. So the poster competition, keeping the theme of the National Pharmacy Week in mind, The pharmacist, the integral part of the healthcare system. So some of the entries we have received from our beloved students, so they have put so much effort. We have seen those, and we have our jury members with us, Professor Subrat Kumar Bhattamishra, the professor of our department, and Dr. Raja Chakraborty. He is also the associate professor of our department. So they have judged based on the quality of the content. And now I am going to present the poster one by one. So let me share my slide, and I have actually arranged all the posters. So we have selected a few, and then we are going to present them one by one. And I would like to request all the participants. Which poster I will show, I expect the participant will unmute themselves, and they will explain a few words, a few sentences explaining the theme of the poster which he or she has made. I guess I'm clear enough. So let me just share the screen. Let me just share my PPT where I have put all the posters together. And one by one, I will call out the name, and please unmute yourself, and then you can explain the theme of your poster. So our jury members are here. So they will judge based on that. Okay, so I guess my screen is visible. Vitasta ma'am, are you here? Can anyone please confirm me my screen is visible or not?
Ma'am, it's visible, ma'am.
Okay, okay, thank you so much. Okay, so first of all, we got the poster of Miss Ankita Roy. Ankita, are you here?
Yes, ma'am, I'm here.
Okay, you can just explain your poster, the theme of your poster a little bit. I can see it's a very colorful, it's a nice poster you have made. So can you please explain a little bit?
Yes, ma'am. As we know that trees are integral part of the nature, like that, pharmacists are the integral part of this healthcare system, because it is a national pharmacy week. We are celebrating, so we can say that we should always remember that pharmacists are the experts. As I mentioned in the bottom of the poster, that we are the experts of your health, and also we care about you, so you can trust us. And we, in this pandemic, it is duty of every citizens of this country to get vaccinated and trust the quality of our services. And also what we study, I show that what we study in the different branches, and also in the bottom I show that which sectors we help in the society. Thank you, ma'am.
Very, very nice poster you have made. Actually, it's a very nice handmade poster. So we have actually opened the entry for handmade as well as the digitally made pictures. Actually, the poster is handmade and it's very nice. Nice job, Ankita. Thank you so much. Then we are moving to the next poster that is made by Irfanul Haq. So, Mr. Irfanul Haq, are you there? Irfanul?
Yes, ma'am.
Okay, so it's a very nice poster, nicely put every picture appropriately in this short span. So please, can you please explain a little bit of your poster, what you have made?
Yes, ma'am. This actually this poster characterizes that how human on earth are dependent on pharmacists. Previously, pharmacists were known to function only as dispensing medicines, but this poster explains a pharmacist intervention in clinical and hospital setting in the rational use of antibiotics, promotion of government schemes, and monitoring of drugs in patient care unit to bring about the optimum drug therapy to patients. And we do medication management, chronic disease management, order and interpret lab tests, sometimes assess or prescribe for minor ailments. So I have put that prescription at the background, so it suggests that we are how we are also dispensing medicines to as a and then I have used that since it is the time of a COVID scenario. So I have used a pharmacist that how they are helping to unite us together and uh, make make a valuable vaccine so that they can further treat us and make us accessible to all our work and help us to bring back to our previous notes so that we can be all together.
Yeah.
That's it.
Okay, thank you so much. Exactly, the main thing, the main responsibility of the pharmacist here summarized. Starting from the information, starting from the surveillance program, the everything to the healthcare program, the treatment, everything he has summarized. Actually, the exactly the thing. Okay, so it actually is going appropriately to the theme of National Pharmacy Week. Thank you, Irfanul, for your poster.
Welcome.
Okay, so then we got the poster from Mr. Ayush Roy Choudhury. So he's also a student. So it is also very nice handmade picture, and some handwritten information is also is here. So can I have Mr. Ayush Roy Choudhury with us so he can explain a little bit of the poster about the poster? Are you there, Ayush? Ayush, are you there? Okay, I guess Ayush is not here with us. So basically, he has portrayed the the every tools and every armory is what pharmacists actually have in hand when they are fighting this huge pandemic, right? So not during the pandemic only, throughout the year, what the people do, what is the role of pharmacists? So they have research under the sleeve. They have the uh, treatment, they how to administer the patients with the appropriate drugs, appropriate dosage forms, how to react with the in the emergency situation. So everything is actually the forte, the responsibility of the pharmacist. They know how to do each and every work with the utmost perfection. Yes. So because of the pharmacists, because of the healthcare professionals, we are in the healthy and safe hands. So thank you, Ayush, for your poster. So it would be very nice if you were with us now at this moment and you could explain your poster in a better way. So no worries. So we are moving to the next poster that is actually made by one of our students, Ms. Shabnaz Kazi. Shabnaz, are you with us in this
Yes, ma'am.
platform?
Yes, ma'am.
Yes. So if
Uh,
you please explain the theme of the poster little bit, so it would be great for us.
Good afternoon to one and all present here. Myself, Sabnaz Kazi, and I'm from Adamas University. We are all here to celebrate the National Pharmacy Week 2021. And thank you very much for giving me a chance to speak on my topic, pharmacist an integral part of the healthcare. I have listed out the pharmacist roles for the healthcare in my poster to make it eye-catching. To go to the flashback, we see how pharmacists took the part to save people's health and life. We were shot by the bang on effect of COVID-19, and it was really tough and strenuous to develop a vaccine just to fight for existence. And we did it. Almost 40 crore people got vaccinations. This vaccine development was a major hurdle, and also it took time to gain people trust to take it. But the pharmacists played a foremost role to avoid them. It was just an example of the system or industry where they produce a variety of medicines or dosage form to safeguard people's health, like tablet, capsules, and syrups from children and elderly people for the easy administration. In every aspects of patient's health, there is a requirement of medicine. So, can we shut our mouth off from commending the use of hand sanitizer? No, we can't. The production of medicine is the first role, and then supplying. People suffering from other diseases like diabetes, tinnitus, etc., were using other tactics in the pandemic days to arrange their medicine from the pharmacy. In this testing time, people got 24-hour online services, emergency services of medicines from the pharmacy. Then come the safety monitoring of the patient, clinical research organizations, and pharmacovigilance case studies. And the data interpretation give the way to work on the side effect of the particular medicine. Then comes the prescription reading and counseling of the patient, and give them mental support and gives them the idea about the food drug interactions. Research and development are innovating effective solution for the health issues with extemporaneous preparations. When at the beginning, when the pandemic, the vaccines were not developed, doctors were prescribing medicines as a temporal maintenance based upon the air vaccines, which was done by the farm chemist. Not only that, when a drug is discovered, it goes under the supervision of clinical trials and post-marketing surveillance to manifest the use, effectiveness, and safety of a proposed drug just to warrant the public health to combat some certain diseases. Moreover, the regulatory bodies like FDA, WHO, GMP, CDSCO, etc., work under some administrative legislation which significantly collect and collate data by national and international agencies. As such, drug abuse is banned by the International Narcotic Control Board. Also, programs and campaigns on smoking, HIV, immunization, COVID-19 makes people faith on us. Also, they get aware. Here comes the role of the community pharmacist and the hospital formularies. They convey minor dressing, interpret prescription, and work as a primary care unit. In rural areas, in absence of physician, he serves on an urgent basis prescribing medicines. So this well-designed system of pharmacy, all checking is done just to save people health issues flawlessly. So in this way, pharmacists promote, restore, and maintains people health and be an integral part of the healthcare as depicted in my poster. Thank you.
Thank you so much. Well done, Sabnas. Actually, it's a very nice poster you have made. It's a digitally made, but it is so clear in depicting all the different roles. How the pharmacists are an integral part of healthcare. Truly, you have taken out the essence of the theme. So, thank you so much for putting so much effort in your poster. So we are moving towards the next poster that is made by Ms. Shejuti Raichoudhury. Are you
Yes,
here,
ma'am.
Shejuti? Okay, so if you can explain your theme of your poster a little bit, so it would be very nice.
Yes, ma'am. Hello, everyone. Myself, Shrijuti Raichoudhury from B.Pharm 4th year, Adamas University. So today I want to discuss on the topic, pharmacy is always trusted for your health. I think health is wealth and nothing supreme. To lead a healthy life, you have to be active and fit. But whenever you are sick, you need a treatment. Pharmacy is that practice of preparing, preserving, compounding, and dispensing medical drugs. And a pharmacist plays a very significant role in patient educations of drug use and effective and safe supply of medicine with proper packaging. And we can call a pharmacist as an all-rounder. There are different type of pharmacy and they have own necessity in their own field. Community pharmacists, it is frontline healthcare which create a bridge between the general physician, nurses, and other healthcare professionals and public, checking doses and ensuring that the medicines are correctly and safely supplied and labeled. In case of hospital pharmacy is the organization of department of hospital to manage the procurement, storage, preservation, packaging, sterilization, compounding, preparation, and dispensing of medicine. In case of clinical pharmacy practice is concerned with the promotion of effective and safe drug therapy. In case of compounding pharmacy, the practitioner's prescription drug order should be maintained properly. And in case of ambulatory care pharmacy, the consist of health related services provided to patients who are not able to work to seek the care, who are not confined to an institutional setting. And in case of regulatory pharmacy, developed from the desire of government to protect public health. Home care pharmacy are also there, which is a full service pharmacy with focus on old fashioned service and independent business. Research pharmacy include development and testing of new drug, dosage form, and also the preparations. Online pharmacy to provide service online. Mostly in this COVID era, this pharmacy have helped people a lot. And the another prospect of pharmacy is blossoming new pharmacists. As a pharmacist is itself a diverse profession with many opportunities. Nowadays, more students are interested to take pharmacy as a profession, and a pharmacist academic help them to achieve their goal by which they can serve for their mankind. Now, the most important thing, faith in pharmacy, which is justified by the immense service given by the pharmaceutical industry and the little pharmacy outlets to the pharmacy in making medicines available to people. Pharmacy provided round-the-clock services and maintained the highest order of professional ethics. Mainly during this COVID-19 pandemic, India shows the ability of pharmacy and earned the trust and recognition in international standard. Trust is a central part of all human relationships and a fundamental element of social capital. For many years, pharmacists have consistently been named among the top 5 most trusted professionals in national survey. Trust is a reserve of goodwill for future use, and pharmacy has built up a big reserve over many years of caring and excellent practice. And at last, I want to conclude with a quote of Hippocrates. I will remember that there is an art of medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. Thank you, ma'am. Over to you.
Thank you so much, Shejuti, for your nice explanation. So you have nicely summarized all the different parts of the of our society where the pharmacists work. So starting
ma'am.
from the small pharmacy to the hospital pharmacist, community pharmacist, as a researcher, as an academician, each and every role is played by the pharmacist very nicely, very efficiently. So you have
Thank you.
correctly summarized this one. Okay. Nice explanation once again. So we are moving to
Okay,
the
ma'am.
next poster. That is also one very nice handmade poster made by Ms. Shourabi Jana. Shourabi, are you with us?
Yes, ma'am.
Okay, so can you say a few words about your poster?
Yes, ma'am. Here I tried to portray my poster as in a very schematic way, where the Red Cross sign, which we all know is depicts to all the individuals of the medical services. And the centrally localized, the picture shows a capsule where the capsule portrays a pharmacist, and the pharmacist is hugging a doctor and a patient, which means that it is the pharmacist always plays a role between the medicine and a patient, means between the doctor and a patient, a link between a doctor and a patient, from explaining the dosage to giving the alternatives, which also brings to all the roles a pharmacist plays in all the fields. We pharmacists are spread in every type of field, from research, healthcare, industry, education, helping the community to suggest the other healthcare professionals, and which makes us an integral part of this whole healthcare. Thank you, ma'am.
Welcome, Shourabi. It's a very nice presentation and a very good picture you have made. Actually, very nice, excellent, and intelligent use of the symbols, actually. So, starting from the capsules, the factory, the plus sign, and the linkage between the doctors, patient, and the pharmacist. So, the connection. So, everything you have made so nicely in a very short space, actually, I can say. So thank you for your poster. So we are moving to the next one, that is made by our student, Ms. Shati Maji. Are you there, Shati?
Onisha ma'am, Swati will not be able to attend today's session because she is out for some reason.
Okay. Okay, so we can see from there, actually, she has symbolized our Ma Durga to be the pharmacist. So as Ma Durga single-handedly using the armories, using the 10 hands of her, handled the bad person. So you can say the Ashur. She killed the, she inhibited the bad power. So similarly, she has symbolized the same thing. She has connected the same concept to the pharmacist. So single-handedly, they they act in several roles. They have they are actually they are doing so many responsibilities. They are acting in so many roles. They are doing so many work all together. So starting from the academics, research, and community pharmacist, hospital pharmacy, everything. They are counseling the patients. They are giving the medicines. They are making the patients aware of all the facts, all the things which they need to maintain. So everything she has symbolized, everything she has made summarized in this handmade poster. So very nice presentation from Shwati. So moving to the last poster that has been made by our student, Mr. Shuman Kollan Shanki. Are you there? So very
Yes, ma'am.
nice digital made piece poster. So if you can explain a little bit about your poster, it would be very nice.
Yes, ma'am. So good afternoon, everyone present here. I am Suman Sanki from B.Pharm third year, and I presented the poster on the theme of pharmacist and integral part of healthcare. As we know, pharmacists are one of the important pillar in our healthcare system. Along with doctors and nurses, pharmacists played a vital role in healthcare system. So through this poster, I have tried to mention the different roles played by an pharmacist or an pharmacy professional and how they are connected to common people. First of all, I would like to mention the academic pharmacist who creates the new generation of pharmacy professional that include associate professor and assistant professor and lecturer. And then there comes the industrial pharmacist who give life to medicine from crude drugs. And when the medicines are made and ready for the market, by this type of pharmacist, the medicine become more available to common people that include different distributor and different wholesale sellers and retail sellers. And there comes the community and clinical pharmacist. Uh, this pharmacy professional would be in direct access to the public. Community pharmacists played an important role in dispensing medicines with a prescription, whereas the clinical pharmacists are involved in optimization of medication selection and dosing and monitoring of medicines. Then for ensuring the drug safety and misusing for protect the drug from misusing there is a drug inspector and other central drug inspectors. And there comes the hospital pharmacist that include hospital pharmacy head and clinical pharmacist. uh, through this poster, we can say pharmacists have a direct access and a important and integral part of healthcare system. Thank you, ma'am.
Okay. Welcome, Shuman. So very nicely presented. So all the participants, they have actually made very nice posters. So be it the handmade, be it the digital made, they have put so much effort. They have summarized. They have taken out the exact essence. They have extracted the exact essence of the theme actually. And not only they have put their effort in making the posters. They have actually put so much effort, so much. They are so much enthusiastic to explain their posters as well. Very nice presentation they have done, they have given. So to actually, in my eyes, each and every poster is good. They are best actually. But actually, the decision of our jury members will be the final when it comes to the results. So to know the results, we have to wait till tomorrow. So tomorrow there will be another session for the National Pharmacy Week as a continuation of the celebration. So we will be having another session. So in that, at the end of the session, we'll be announcing the results of the poster competition. So our jury member, Professor Subrat Kumar Bhattamishra and Dr. Raja Chakraborty is here. They will judge all the posters on the basis of their quality of the content, their presentation, their information, everything they will judge, and we will let you know the results. So now this has come to the end of today's session. So it was very informative, it was very interactive, and it was very very much so we got so much participation from the students in terms of the posters. So we have got to see very nice posters from our students of our department. So thank you all the participants over here. Thank you all from the department, all the faculty members, all the students, everyone.
Hello.
Yeah, Vitashna ma'am. Yes.
Ma'am, actually, Dr. Shubrat Bhatt Mishra sir is here. So if we can call sir.
Yeah, I am just about to call sir. Yeah. So on behalf of the department, I would like to call Professor Subrat Kumar Bhatt Mishra sir to finally conclude the session with the formal vote of thanks. So sir, over to you.
Okay, thank you, Dr. Anisha. Thank you so much for inviting me to this session. I have been this session since 3 o'clock. Yeah, we started with 3 o'clock. And
I know, sir.
I think this session is very, very interesting. And I was really happy that the participation of the students is how they have participated with their creative ideas in projecting their posters. Okay, that's I really amazed to see the participation and the way how they projected their thought in the form of poster. And then before that, we had a very, very interesting talk. And I feel it is a very important talk also. That is, the talk title was Role of Pharmacist in Rational Use of Drug. Okay, so since we are ending towards the session, today's session, so I must thankful to everyone who has participated. So I will just formally announce the vote of thanks now. So so good afternoon to my colleagues and my students for attending today's session. And I must thankful to our speaker, today's speaker, that is Dr. S. Rubesh Kumar, who is a professor and vice principal in Tigala Ram Reddy College of Pharmacy, Hyderabad. He has delivered a very important and insightful topic that is role of pharmacist in rational use of medicine. I think which is this topic is essentially and appropriately fit into the themes that is our National Pharmacy Week theme, that is pharmacist an integral part of healthcare. Okay, and during COVID we have seen that there is a new term emerged that is called as black fungus, isn't it? And if you remember that the black fungus is said to be due to the overuse of steroids, and due to overuse of steroids that may lead to secondary infection, although it has been not scientifically very much proven, but still the clinicians, they are working on this hypothesis that overuse of steroids has led to secondary infection, and that causes black fungus infection in COVID recovered patients. Okay, and similarly we have also problems like irrational use of antibiotics, which is a big challenge to the healthcare system of our India. And we believe, and as a future pharmacist, you are the persons who are going to take care of this inappropriate and irrational use of medicines, because you are the most important part of healthcare system, and everyone expect our responsibility in checking the irresponsible or irrational use of medicines. So I must thankful to Dr. Rubesh Kumar, although he is not present in this session now, but I must thankful for his very knowledgeable and very nice deliberation of the talk. And so that's my thanks to Dr. Rubesh Kumar. And next we had the poster presentation, and I can see that there are 9 students who has participated in the poster presentations, And I say that I'm amazed to see that the way they have presented their thoughts and the beautiful presentations with beautiful narratives and explanations. So although everyone has participated, and I feel there will be few winners, but in my opinion, all are winners after this, looking at the post presentation. So this is very, very impressive, I can say. And I must thankful to all the participants for their poster presentations. And my thanks goes to Dr. Anvesa, who is the moderator for today's sessions, and Dr. Bitasta, who is the convener of NPW celebration. So, and they have done wonderfully, and they have organized all the events wonderfully, and they have really working hard and tirelessly to organize this National Pharmacy Week. So my thanks to both Dr. Anvesa and Dr. Bitasta. And I must thankful to Dr. Sajal, who is our dean, for actually supporting and encouraging to organize the National Pharmacy Week in a very eventful way and very organized way. And I must also thankful to Dr. Sanjay, the head of the department, our Department of Pharmaceutical Technology, for all his support for this event. And I must thankful to all my colleagues who has been presented, who has participated this event, and who is also working tirelessly or working or supporting directly, indirectly for this event in different capacities. And last but not the least, I must thankful to all my student friends. Okay, those who are budding pharmacists or those who are future pharmacists. And this event is for you. It is not for us, it is for you. This is your event. So I hope all my students should participate and should enthusiastically participate in a National Pharmacy Week and make this celebration a success. So that's all from my side. And with this, I must thank everyone who is here, and thank you so much. So with this, we can end our session. Dr. Anvesa.
Yes, sir. With your due permission, we can conclude our session for today. So tomorrow there will be another session. You will get the emails, you will get the communication from your respective class coordinators. So you have to join the session for tomorrow, and you will know the results of the competitions tomorrow. So thank you all for staying with us. So we can conclude our session now.
Thank you.
Thank you. Have a good day.